At the highest level, what we did is we looked at everything, all drugs, regardless of whether they're specialty or not specialty, whatever, everything, excluding what we had talked about before, the radiopharmaceuticals and the vaccines. And we looked at, okay, what does it look like from a wholesale acquisition cost perspective and the trend? And what you can see here is the left side, the percentage reflects the trend. The x-axis, as you can see, reflects the year of the analysis. The deltas, so 2014, you see the 6%, is actually the trend between 2013 and 2014, so how much of an increase. And then you can see as a comparison to that, the consumer price index for the same time period, similar to the first slide that I showed, where we're comparing the consumer price index for medical care versus the just general consumer price index. And what you can see in 14 to 15 is pretty much what we would expect, which is it's trending higher than the consumer price index. But then something interesting happens in 2016, and is that now, compared to the previous year, the drug and trend actually goes lower for these on the medical side compared to the general consumer price index. And in 2017, it actually drops below what it was the previous year. And then so in 2018 through Q1, it was actually in parity to the consumer price index at 2%. The other piece which, as you're looking at this data, keep in mind is we're looking at pricing at the HCPCS level. So we're not looking at the overall NDC package. So this normalizes the actual pricing down to whatever the descriptor on the HCPCS level. So if it's 10 milligrams, then it's all the NDCs that are components of that are normalized to that 10 milligram descriptor. The other piece of this graph is you'll see the lines. You have the dark blue and the light blue is at the same time period, what's going on in regards to the number of brand products and generic products that are within the NDCs evaluated. And at the highest level, as you can see, is that there's significantly more generics than brand products. When we flip it and look at the ASP plus 6%, it's a very similar view, except that the flip occurs also in 2016, but then the negatives are just 2017 and 2018 comparatively. This could be due to several things, one being that typically ASP, many drugs is less than WAC, as well as the fact that the methodology Medicare uses to determine ASP results in very competitive pricing, and also ASP tends to be 6 months behind. So the 2018 numbers might be reflecting price decreases that occurred in 17, whereas in the previous slide, when you look at the 2017 numbers, it was just for 2017.